Welcome to the Mayor's Corner. And before we introduce my guest, I would like to say a couple of things. We are very, very lucky today to have Karen Hayden back in the director's chair, director extraordinaire, and she has, I believe, bumped Jamie Atkinson out of that chair. And trust me, that is a good thing for you, the viewers, and for Methuen Community TV. So, having said that, thank you, Karen. And Jamie, I hope you don't hold that against me in the future. I would like to welcome our guest, Lisa Tkachuk from Senior Whole Health. First question is, did I pronounce the last name right?
Perfect.
Tkachuk.
Perfect.
Okay,
Perfect.
let me say this, that I was a little worried about that, but I feel we're off to a fast start
There you
here.
go.
Lisa, you're from Senior Whole Health, and I know honestly that the people that you help are very impressed with the program, but let's talk a little bit before we get into you personally about what is Senior Whole Health. For those people that don't know what it is, what do you do? What is it? What is the program about?
Well, Senior Whole Health is a health plan for seniors. They are the people that qualify for a program like this. They reside in the state of Massachusetts. They are over the age of 65, and they have both Medicare and Mass Health benefits. So if they're getting Medicare and Mass Health benefits, they see one of the doctors in our network, they live in Massachusetts, then they can roll into a program like this for free. It's a free program for anyone that meets that criteria.
Okay, so they qualify, but explain what the difference is then between being in Mass Health and being part of Senior Whole Health. Are you a subsidiary of Mass Health?
No, no, not at all.
Okay,
no, we're contracted with both the state and the federal government to provide a managed plan for the seniors.
I gotcha.
So when they enroll into the plan, they still have their Medicare and Medicaid active. It's still active. It's in the background. But we become primary payer for all services, any medical services, and that will encompass dental services, vision services, skilled nursing services, hospital care, community care, regular doctors, specialists, things like that.
So those criteria that you listed, that means that if the seniors are eligible and they are enrolled in your program, the cost to them is?
Nothing.
Nothing.
Zero. It's a zero pay plan. So people that qualify for this program are going to experience having a program that gets extra benefits, which they don't have any co-payments, no deductibles, and no premiums whatsoever. So they'll never see a co-payment for a medicine. They'll never see a co-payment for transportation, anything like that.
Yeah.
There is absolutely no fee for them to be had.
Well, no, that's extraordinary, particularly in this day and age of healthcare costing really almost everything we make, all of us.
Right.
But how do you become eligible, and who is eligible? Is there anything beyond what you just described that would get you to eligibility?
No, I mean, the key is that the fact that the members are the people that qualify have to be on Mass Health. That's key. That is the baseline for the program. So. And these are the people that are in the lower of the income levels with the state. They are not wealthy people. They are running into they've been in the system for a very long time, and they're just rolling into a little bit more difficult system when they turn over the age of 65. So those are the people that are really eligible for this program. Which is why that there's no co-payments or anything like that.
Right.
This really allows the person to remain home longer, and that's really the key, is to keep people home longer, to keep them out of nursing homes and rest homes and things like that, and be able to help support them in the community so that they can stay at home longer with their family or in their own.
So are you network driven? You have a network of physicians, or do you explain how that works?
We have a network of physicians that we work with all over the state. We're licensed in all over the state except the Cape and the Islands and the very western part of the state. Other than that, we have a pretty robust network of physicians that are tied to just about every hospital around that we're able to that work with this program, and they're able to help provide services to our members.
So if a senior has an existing doctor, there's a good likelihood that that doctor would be involved with your network, and they would not have to change over.
Right, and we really don't want anybody changing physicians. The plan is definitely all about choice. We give our members a lot of choices in a lot of different areas. But we would prefer them not make any changes to their primary care physicians, because most people have been seeing doctors for such a long period of time that we don't want to interrupt that continuity of care. That's very important to us, that we don't make any of those changes. Should someone decide they want the benefits, but they don't go to the doctors, they would like to change, that's fine, and we can help them with that. But we prefer that they don't change. Now, we are constantly enrolling physicians all the time, credentialing people all over the place. So, if someone's not on today, doesn't mean they won't be on in a month. And we usually have a pretty good idea on who's coming on and when they're coming on, things like that.
Sure, so you could always give some guidance on that. Okay, so now we understand a little bit more about senior whole health, and obviously that's what we want to talk about today. But how do you, one of the questions we generally ask our guests, I'm not going to ask you is how old you are, but we're not going to ask that today. So how did you get involved with senior whole health? And how, what did you do before that? Let's learn a little bit about you.
That's actually a little funny story. My background is basically in the nursing home industry. I have 15 years background of experience with in regional and VP positions in the finance area of nursing homes, in running nursing homes, in more of a regional and corporate position. When I came to senior whole health, my last job, I just go back, my last job allowed me to experience senior health from its inception in 2 of my buildings that I supervised. When we started, this company started, enrolled 40, 50 people at a time. So I got to work with senior whole health on the other side since its inception until I was called by the marketing director at the time, said, we need help in our nursing home division. Can you help? Can you come work for us? So, I decided to take a leap of faith and do that. So once we revamped the nursing home division, now I oversee all the nursing homes that we have in the state, all 67 of them that are contracted. Plus I have the whole community, the Merrimack Valley community, the whole north of Boston.
All north of Boston,
community.
Very good. So what is your title?
I am let's see, what is it this week? I'm the Marketing Relations Specialist for the Merrimack Valley area.
I got you. Okay, that is outstanding. So now we know a little bit, bit more about you. All right, that's great. I know that we talked a little bit about that, the copayment issue, and you say there were actually 0 copayments.
Zeros.
So explain a little bit about, let's lift the hood up a little bit here. How do you get to 0 copayments, and what's the funding source, and how do you guys exist financially?
We actually are we're a for-profit company.
Yep.
We are contracted with both the state and federal government, and what that means is that they pay us based on our membership. And based on the clinical levels of our members. So we don't bill them for services and they pay us. They give us one lump sum per person per month, and then we distribute payments from there. So it all goes into one bucket and then we ship it out. But because we do that, and we have to follow their guidelines, we have to offer, the minimum expectation of us to offer is what Medicaid would offer, what Medicare would offer for services. Sure. But we are allowed to, with approval, to expand on those services, which is what we've been able to do, as in giving no co-payments, no deductibles, no premiums. Paying for transportation, which is a huge benefit to any senior that has trouble getting to doctor's appointments. We pay for interpretation services. We pay for a variety and a vast amount of home services, PCA services if it's clinically appropriate, and that's how we've been able to keep the dental benefit intact. The dental benefit with Mass Health adults was cut out in July of this past year, yes. July of 2010. But we didn't cut any dental benefits out of our program. So even going forward for 2011, our members will still receive full dental care, from crowns to restorative care to root canals to dentures. All of those big ticket items are still available.